Welcome, ladies and gentlemen, to another exciting episode of Grant Source Live. Today, we have the founder and principal for one of the most revolutionary medical companies on the planet today. But before we get to Kyle, I have to get a shout out to two of my sponsors. First is Paychecks. From hire to retire, they will help you with all of your payroll and HR needs. And for all of you business owners that need to get your finances and your taxes together, KSB Financials and the good people over at K&M Mamdani can help you get everything straight. So now, without further ado, Kyle, how you doing, man?
Doing good. Thank you for having me on the show.
Phenomenal, man. Well, we're blessed to have you a part of the show, and I had the honor and privilege of meeting Kyle through one of my other clients at Startup Grind. Shout out to Michelle, introduced us probably about a year ago. So excellent, and glad to have you on the show. Tell us, Kyle, where you from, man?
Originally, I'm from South Texas, down right along the Rio Grande River border. McAllen, Texas is the city. It's about, I don't know, maybe 500,000 people now. But grew up down there. As soon as I graduated high school, I had the option to either work for the family business or go to college. And I needed to get out of McAllen, so I moved to Austin, Texas. And I lived there until January of last year. I helped the company close a round of funding here in Houston, and part of the deal was me working out of their office. So that's what made me land in Houston last year, and I've been here since. Really moving around the state of Texas quite frequently into the different major metro areas because we're working with multiple county systems to help them with the healthcare issues that they're facing. So we've been opening up several markets in the state of Texas, kind of in parallel. So yeah, that's a kind of background of where I'm from.
Nice, man. And you know what? For everybody on the show, you probably weren't prepared to say this, but where'd you start? You started from the border, now you here, man. I had to throw it out.
Started from the border, now we're here.
Now you're here.
That's my little remix that I don't even know who has that track, but it is a throwback.
There you go, man. So tell us, and we're glad to have you on the show. So you're from the Valley. What are you passionate about? And then we'll kind of get into the impact that you're creating with MRG.
Yeah, I mean, I've always just been driven to just help people, whether it's just doing something that somebody needs a favor for, or actually, giving back in some kind of way. I'm really passionate about just teaching and showing people, how to do things that will make them become either just a better, individual, a better person in themselves, or just build a skill set, whether it's in sports or business, and just teaching in general, and sharing the knowledge and just learning experiences that I've had. I guess evolvement, just watching people or different things evolve and grow is something that really drives me.
Excellent. And you've been able to do that. He's a serial entrepreneur, been involved in a bunch of different, not only businesses, but sits on the board for multiple nonprofits, had the opportunity to, and the gift and the curse of going to Ferrari Kid, bringing my daughter, and he put my daughter in a Ferrari, which is very expensive.
Yeah, that one's gonna follow you. She's not gonna forget that when you sent me that picture of when she was in the arcade. You said, "Look what you did."
Oh man!
Get ready. You better set up a separate savings account for that car.
But man, what you've been able to do is incredible. Not only for the different organizations that you've been a part of, but for MRG as a whole, because our healthcare system there's a lot of gaps and there's a lot of flaws. And let's pull up one of those pictures just to kind of show them what MRG stands for and the foundation of it. And tell us about MRG, Kyle.
Yeah, so MRG, I'll just kind of give a brief background of how I kind of came up with the idea and the concept of this healthcare vertical of MRG Global. I started out, I was gonna start a mobile imaging company back in '08, and so I have a formal healthcare background. I have a degree in vascular general obstetrical and cardiac sonography, and I have a bachelor's in science and business administration with a minor in marketing. And I got the degrees in ultrasound because I was going to start a mobile imaging company. It's basically a concept where we help primary care doctors, better treat, better diagnose, quicker their patients that require an ultrasound for a diagnosis. And so basically we would send a tech out to the patient's home or to the doctor's office. And instead of him referring that patient to a radiological facility and making that patient take off work again or off school again and have to go sit in a waiting room and get their exam and then wait another week or two for a radiologist to read it and get the results back and then schedule another appointment, and you're a month or two out, and it could be a cyst from cancer, or you never know what the diagnosis is. And so this really just speeds up the diagnosis process. And so I was I came up with the idea of doing that, and I always wanted to be in healthcare, but not really on the practicing side. I wanted to be on the business side. And that's really where my kind of healthcare scene evolved. Fast forward to 2008, 2009, I can't remember the year, Obama became president. The reimbursement rates dropped on Medicaid and Medicare, which is what all the other payers kind of use as their baseline. And so the lucrativeness of the business model fell out the floor. It dropped by 30 or 40% overnight. And I was like, okay, I didn't do this to become an ultrasound tech or a sonographer. And so I had to figure something else out. And that's kind of when my true entrepreneurial spirit, I guess, had to take over or get involved with what I was doing. And so I got into payment processing or financial technology and marketing technology. And that was the first company I started back in 2011. It's called Merchants Resource Group, still exists today. And it was a company that we focused primarily on helping with business services around marketing, payment processing, and point of sale systems. And, we focused on the retail, hospitality, and auto dealer markets. Was very fortunate and blessed to have been able to apply the skill set that I had and create that company, which was all built around residual income. And so that allowed me to, over the time of building that up, to really focus on healthcare eventually, which was my passion, all along. And so I've been really blessed and fortunate to be able to build that business initially and it bankroll a lot of these different ideas and things that we're doing. Around about 2 or 3 years ago, I pivoted and I got back into healthcare. And we really focused on the lab and pharmacy space, but around patients that have chronic illnesses or chronic diseases, and because those are the ones that are in the most need. And
doing
so
that the right way, right?
have,
Yeah, because in Houston, anytime people hear lab and pharmacy, I mean, everything has gone down here, right? So doing it the right way, you have an incredible team.
Yeah, I mean, the labs and pharmacies that I'm now partnering, they've all been around for over 10 years. They're all ran by either CPAs that have been in the space for a long time or actual physicians that have PhDs in their space or their specialty. I learned that the hard way, referring back to what Alan was touching on, is it's frauds. There's a lot of fraud and abuse in the medical healthcare space. That's why U.S. has the highest healthcare per capita or per patient in the world. 19 cents out of every dollar spent on healthcare or spent in the U.S. is spent on healthcare. So we really focus on doing things above board and compliant there. We only charge a certain times Medicaid and Medicare, because we're focused on helping the underserved and the elderly population, which is government issued insurance. And we are 110% above board and compliant, because we all know what happens when you're doing things that aren't legal or that are not above board and compliant in the healthcare space, especially around federal insurance. And it's definitely, it's sad that people take advantage of the system that way, but it is what it is. So we actually have tools and things built into our technologies that are fraud detection tools and fraud prevention tools that not only hold us accountable and our staff, but it also holds the doctors accountable from overbilling and doing diagnoses that didn't occur, or saying that they did a certain exam that they didn't do, billing for 30 minutes instead of 20. So we have a lot of tools that really, we know that's a big problem, and that's kind of how I really came up with a lot of these concepts, as I went and found the major problems that the state and the federal governments are facing, and we created solutions around those problems, whether it's virtual care management or revenue cycle management. But yeah, I just makes me real sick to my stomach when I see these different indictments and lawsuits and things that are happening in the space because of this fraud and just people not having integrity when it comes down to the billing and reimbursements of things.
Yep. And so the Vital Care 360, and if we can go back to that, the Vital Care 360 platform encompasses everything. I mean, you're not only helping the underserved, you're helping veterans, you're helping people in rural communities, and you're doing everything, right? Hep C, cancer, everything in one platform with the band. And let's pull that up.
Sure. Yeah, I mean, this Vital Care has been something that we've been developing for almost 4 years now, really under the radar, kind of in stealth mode, because we are first to market doing what we're doing. And back to kind of how you introduced as far as kind of who we're serving and the population that's really in the most need. It all starts with population health and rural health. Really focusing, there's 4 main verticals on the clinical side and 4 main verticals on the health, on the population or the patient side that we focus on. And how we defined our market segments was the major issues or the top 4 problems that healthcare practitioners or healthcare systems are facing. And so it starts with primary care, OBGYN, mental health, and then chronic or infectious disease. So those 4 major specialties, there's huge shortages of doctors, not only in the US, but across the world. So what do we need to do there? We need to train mid-levels, train nurse practitioners on how to cover those areas or fill those gaps when it comes to the clinical side, because there's shortages of doctors. On the population side, we start with the elderly and the underserved population, because those are the ones in the most need, and the ones that need more access to care. They have issues with transportation, getting to the doctor. And so through our virtual care management platform, we're able to really serve those patients 24/7, 365 through our vital tracking wearable technology. The second population is rural health. With rural health, it's a major issue again globally. There's just in Texas, where we're at our own home state, there's over 3 million patients in rural Texas, and most of them don't have a hospital or a clinic within 25 miles of them. So with our technology, we're really able to serve those populations, especially where there's internet issues, because our watch is built in with the Snapdragon Qualcomm chip. So that basically allows the watch to basically be like a phone plan, and anywhere that there's a carrier that covers through 128 carriers in the world, our watch will pick up that signal and use it as the internet. So we can really serve those populations that either don't have Wi-Fi or just don't have coverage in their area. The third really area is our veterans and first responders. A lot of the first responders and veterans, especially in rural Texas and just rural states in general, or areas that have states that have rural areas in general, they really, they need access to care. I did just kind of a little case study myself, and I went to the VA in Houston, and it took me 45 minutes just to find a parking spot. Like, people just, the system is not in their favor. And, there's been, it's sickening as well, billions of dollars, 2.5 billion given to companies that are trying to do what we're doing over the past 5 years. And all of those companies have burned through the money and don't have anything to show for the VA. So we're really passionate about serving the first responders in the veteran market. And the third is schools. Mental health in schools is a big problem. A lot of the underserved indigent population, either parents just don't have the means to support their health care. And so, being able to basically through our technology have health triages in these schools and make a school basically a full clinic by using the nurse or even just a virtual nurse as the clinician. And so, we've done on all of these issues, we've done major studies with major universities in Texas, Texas Tech, Texas A&M, and Baylor. And we really went and sourced out all of these major problems and created solutions around them. And then from the solutions, we created technology around them. And, I think that's really kind of the key differentiator that sets us apart from a lot of the companies out there is the fact that we know where the problems are. We developed our technology around those problems. And so it really hedges the bet or the risk of the payers and of the healthcare institutions that the investments that they do make into us, if they ever are needed to make investments on software or technology or our doctors or population health experts, it's going to be money that's well spent. And that's what's really kind of important to me is making sure that the grant dollars that are out there, the grant dollars that are getting awarded, these budgets that are put in place, like we need to help these politicians and these different organizations, healthcare executives, make sure that they do the right due diligence and that they're spending their money accordingly and appropriately, so that they can maximize each dollar spent and really help the people that are in need.
Yeah, and that's huge because to paint the picture, we all have a mother, a grandmother, a sister, a cousin, the whole population, overall, baby boomers are starting to retire. So we can put, and for lack of a better word, these Fitbits on steroids that have every single healthcare, it tracks all of your vitals, right? And life alert. It's everything, all these different things in one platform, and they can feel good about it because you get help right away. And if you're in a rural area, you can do it through telemedicine. What you're doing is incredible. And this isn't two guys in a trick duck in their basement. You have some of the top doctors in the world on your team with this platform.
Yeah, I've been blessed and fortunate to have just been able to cross paths with some of these people and just tell them, our story and what we're doing and the impact that we're trying to provide and create, and which we're getting a lot of traction and helping a lot of people. And, they really believe in what we're doing. They know the problems that are out there globally. And like you said, these are all world-class influencer, almost, status positions and just healthcare professionals that have been on, world stages and, Dr. Oz and I can go on just kind of the caliber of experts that we got. And it takes that to really, make the impact that we are making and trying to make. I can't do it myself. I had some ideas that, I've been chasing for a while and have been able to really attract a phenomenal team of not only healthcare professionals, but of data scientists and technologists and business executives to help, keep things together. I can't do it by myself. And when I would go out and source these people out and get the opportunity to pitch them, they pick me apart. They kick the tires off me. A lot of times it was a reality check, but now they're on board and they're, 110%, willing to do what we need of them, to really make these issues that we're facing, not become issues for these health systems anymore and these patients.
Yep.
It's been
real quick, Kyle,
a ride, but we're doing good.
Yeah, we're coming up on time. This was a special show because healthcare is something that's near and dear to everybody's heart. Few closing questions before we wrap up. One is, what can our community do for you?
Yeah, I mean, the main thing is it was mind blowing to me this week. I met with 3 primary care doctors in Houston, and all of them, I asked them, are you familiar or aware of the new CMS, RPM, and CCM billing codes and what the government has rolled out for you physicians? They're like, oh yeah, we heard of it, but we're not really sure about it. We don't know the details, and doctors just don't have time to work on their business. They rely on their staff to do that, and a lot of times their staff becomes very complacent and they're there to collect a paycheck. But it was stunning to me that these doctors aren't even up to date on these new laws. Like, if the doctors aren't evolving and adapting, they're going to be like Toys R Us or Blockbuster. They're not going to be around very much longer because they're not going to survive. The margins have gotten too small, and so they need to adapt. And so our program, remote patient monitoring and chronic care management and just virtual care management in general, it was really built to incentivize doctors to utilize the technology and to better treat, better manage, offer better care, make it more accessible, and do it through technology. And they can do this spending minimal time on these patients. It's triaged out to mid-levels or medical assistants, where the doctors are spending their time and focus on the patients that are in need of their real face-to-face or even virtual time. And so that's what we've really built the software around, is triaging and helping physicians maximize their time on the patients that need their help the most. We've also really, really been able to prove and show hospitals, county hospital systems, the ones that all of the underserved and indigent people are using their emergency room as their primary care doctor, but we've been able to really show these hospitals tens, if not hundreds of millions of dollars in savings, just preventing people that leave the hospital from returning back within 30, 60, or 90 days. So this is a movement like that we're doing here. I mean, we have some A-list celebrities. We obviously got a phenomenal team. We got, if not the best, one of the best technologies in the world. And the world needs to know. I mean, we're already working with India, Australia, Dubai, major counties in Texas. We've met with the city of New York and the New York Health and Hospital Systems. I'm going to be meeting with LA County this next week. And it's almost unbelievable the amount of money that hospitals lose and the penalties that the payers, whether it's federal or commercial, what they're dinging them and penalizing them whenever a patient ends back up in the hospital. It's literally hundreds of millions of dollars.
No, and so that's a great.
Just to sum up, like our system, it creates almost a layer between the patients and those systems, and it helps us better manage the patients that are getting released and keep them from coming back to the hospital. And that's probably the most impact, and it's really educating the physician communities, the primary care doctors, and the hospital systems and the payers on all of the data that we have and the checks and balances that we have in place, so that we can really help control healthcare costs and create value-based healthcare models through all of the data that we're able to compile and use in real time.
And so that's a good segue. That's what I was going to ask you next. And we see that you're changing the world, and we only you see the world in the background. We only have people on the show
I'm not
that
changing
change
the world.
world.
I mean, I have a team, and it's not me alone. I mean, these have been ideas that I've just been chasing and building the right team, and we can dive in later to all the entrepreneurial stuff that it takes to be able to attract the right team and develop a technology. But it's definitely a team effort. You know, when I would recruit these doctors and executives on board, I would use an analogy almost every time with everyone. It's like, who wins the World Cup? Who wins the Super Bowl or the World Series? And it's the best team. And so I'll never take all the fame myself. It's definitely been a team and a group effort, and couldn't have done it without the people that I have around me.
So if you get a grant, Kyle, I know there's a lot of different areas that you're working on. What are you mainly going to use the grants for?
Yeah, so the technology is built. We got the highest security clearance with the DoD and the DOJ. We're doing some things with already 2 divisions of the military. And so it's proven and tried and proven. But my main focus is the underserved and rural health and veterans. So those 3 main markets, and really serving the people that need to have the healthcare more accessible and that don't have the means to either get to the doctor or to cover the cost of the watch or the app or the platform, whatever hardware, blood pressure cuffs, glucose meters, pulse oximeters, anything that our watch doesn't track, somebody has to cover that cost. And it's not going to be the doctor, it's not going to be the hospital. The hospital might when they're able to see the amount of money that we're able to save them in penalties and readmission rates, but somebody needs to cover these costs. And so, I'm putting together a patient funding initiative that's backed by a private equity fund, and that covers just the equipment. But where we can really use the grants that we're hoping to receive from GrantSource, which they've done a phenomenal job on identifying the available money that's out there and really interviewing all of the doctors and the key stakeholders that we have to get everything out of them and out of their head that will apply to these grants so that we can maximize our opportunity, because we're not the only ones applying for these grants, and whoever else is listening to this, you're not the only one that's going to be applying for your grant probably. So you need to really try and set yourself apart in whatever space you're in. Yep. And so you guys have done a phenomenal job at taking this off my plate, which, with most, executives or founders, you're already working, long hours and to have another task, so, GrantSource, you guys have really been good at that. But to answer your question, I mean, the funding is that we would use this is for rolling out our program, taking it into other countries, getting it into markets where people are really in need, covering some of these hardware costs and some of our operation costs. I mean, to this point, we've completely self-funded and bootstrapped everything that we've developed here. There's been a significant amount of money put into this, but we're ready to scale and to get this out to the masses now. And one of the reasons why we're on this podcast is, it's kind of the new channel or medium to get the word out for different technologies or causes. And this is definitely it's not a money play. Like, we're about impact and we're about serving people and saving lives. And there's nobody doing what we're doing in one platform, and we need to get the word out. And so, that's probably another thing that we might use some of that money for, is not only educating the market and the patient bases and the physician bases, but once they get enrolled into the program, keeping them engaged, having value-based models that incentivize these patients that are chronically ill to take their medicine on time, jump on the scale 3 times a day if they have congestive heart failure, or, cover some of their medication costs if they don't have the money to, to cover their co-pays. Or so we're really, we've been blessed to, from our past successes, to be able to really dump a lot into this. But we're at a point now where we're looking for investors, and obviously one of the ways to help underwrite some of these costs is to be able to tap into some of the funds that are out there, which, what you guys have done for us and have identified, it would have taken hundreds, if not thousands of hours of man hours for somebody to go scatter the internet and put it all together and identify the RFPs. And your guys' tool has been great, and I look forward to maximizing it and working with you guys on that.
Well, we appreciate that, brother. And usually I ask people, what they like about GrantSource, but you already did it for me. I appreciate that.
No, I didn't even know you were going to ask me, but
yeah,
I had to
no,
definitely let the...
I appreciate your support, and I know through working together, it's not about the money with you, and that's kind of our tagline, but let people know there's a number of, and we're not talking about money, there's a number of individuals that you want to impact with this platform. What is that number?
We have our goal is 100 million patients.
Yep.
Within the next 3 to 5 years, to use influencer marketing, which has really changed the dynamic of marketing in the whole entire landscape of this whole, social media movement and just traffic in general, all kinds of different types of traffic. But we want to find celebrities, athletes, people that are suffering from chronic illnesses that we can help, and let them be our microphone or our megaphone. We're going to be aligning a lot of our marketing and PR initiatives and efforts with all the news stations. Like, we need to educate physicians on this. These are new federal laws that have passed that they don't even know about, and they're designed and developed to help these doctors. They're hurting right now. A lot of them, they've dropped their reimbursement rates by 30 to 40% in the last 5 to 6 years. Like, their margins went 30 to 40% smaller, and their overhead went higher. More compliance, more regulations, more insurance, and their margins went. So it's like, what are these doctors doing? And they don't teach any of this in medical school. This is not any of this accounting and business, and it's not. It's all clinical driven in medical school. And so educating these physicians that companies like us are out there to help them adapt. Most physicians they've been doing the same thing for the past 10 or 15 years. Every day, the same thing. The only thing that's changed is now they have to use electronic medical records, or else they get penalized, by 3 or 4% every freaking dollar. And it's like, so, really it's educating the community, not only on the clinical side, but on the physician side, on the population health side, and letting them know that we're here to help. If you don't have the money, we have our own nonprofit. It's the MRG Foundation. It stands for Mentorship, Resources, Giving Back. You sign a hardship program, and we'll cover the cost of your equipment. We'll ship it to you. We'll get you set up, and we'll start monitoring you and help you better manage the issue that you're with. And we'll try and help you come up with a cure. One of our doctors is a hepatologist. We treat people for Hep C, and people think, 5% of veterans have Hep C. They don't even know it. They haven't even been screened. And so, they all keep going that way. They're going to end up getting cirrhosis of the liver, and their liver's not going to be good. And then that's really going to, catapult them into a whole nother category of chronically ill patients, the stuff that's not irreversible. So it's really education and just letting, I keep saying the U.S., but letting the world know that we're here to help, and every dollar that's spent on our healthcare, we're going to maximize that and use it where it needs to be spent the most. So,
well, Kyle, we appreciate and eternally grateful for what you're doing. You can hear his passion, his enthusiasm, and I'm going to congratulate you right now on helping change the world. It's not if, but when you will help over 100 million patients with this revolutionary platform. I want to thank our sponsors, Paychex and KSB. the good guys at K&M Financials, for helping sponsor this show. Kyle, one more time, I appreciate it. You guys be blessed. I'm Alan Thornton. I am the founder and executive director for Grant Source, where we help you find money for your mission. And remember, it's not about the money. It's all about the impact. Have a best day.
What do you think, dog?